West Virginia University. Welcome back to another episode of What's New with Jloo. On today's episode, we'll be discussing the recent coronavirus outbreak and the steps we can take to fight back against this pandemic. I would like to introduce to you guys today's guest star, Dr. Nathaniel Wessex.
Thank you for having me on the show, Jloo, and thank you to everyone watching.
Dr. Wessex, I have been so ecstatic since you agreed to join me on today's show, and I have been looking forward to our discussion. Doctor, I'm going to start you out with the question that's been on everybody's mind. Why is the COVID-19 virus still running rampant in the world?
Well, that does seem to be the question on everyone's mind, but it has an easy answer, but with a difficult resolution. You see, from my research and the research of others in the scientific community, we are seeing more and more cases of asymptomatic patients.
Asymptomatic patients? What's an asymptomatic patient, doctor?
An asymptomatic patient is a person who simply has the disease but doesn't show any symptoms of it. In the case of COVID-19, someone could have the virus but doesn't have a fever, is breathing normally, isn't coughing. You would have no idea that the person is infected.
Now, doctor, that sounds horribly dangerous. It's practically like having a double agent as one of your friends and neither of you are aware of it. It's like a Trojan horse, but both the Greeks and the Troys are defeated.
That is correct, but in a weird, impressive sort of way. You see, these asymptomatic individuals, whether they are aware of their condition or not, are the reason that the pandemic progresses. Here's a perfect example of how this transfer of the virus occurs unknowingly. An asymptomatic individual goes to a dental surgery for, say, a root canal. The dentist proceeds in, lets the operation, and sends the individual on their way. In the midst of the surgery, the individual breathes the virus onto the dentist, and now the dentist takes it home to his wife and kids. And just like that, you have 4 more cases on the list.
That is truly one dastardly series of events. And if what you're saying is true, what can we possibly do to stop it?
Well, Mr. Lumen, I believe you already know what I'm about to say.
So you're thinking that I'm thinking that you believe in what I'm thinking?
Lord, I hope so.
So, before someone would go into a dentist's office, they would first have to get a COVID screening, test negative, and then be welcomed into the office. However, if they test positive, they would just be out of luck and have to deal with the dental problem that they're facing until the virus exits the body? But what if it's an emergency dental surgery and must be done right away? Is that just a risk we have to take?
Unfortunately, it is, but it will lead to more lives saved in the grand scheme of things.
Dr. Wessex, there's still something that is bothering me, though. How can we test for the coronavirus in a patient?
Well, that's quite a simple answer, too. So, you see, the rather painful insertion into the nasal cavity that doctors have been doing all of this year since the beginning of the spread of the virus. The sample is actually clusters of RNA, a single strand of a DNA-like substance that carries information for making proteins.
Oh, wait, doctor, you're the director of microbiology at your university, right?
Yes, I am. In my laboratory, we use PCR to test the coronavirus. Polymerase chain reaction is a technique we use in order to amplify and multiply the strands of RNA in order to test them positive and negative.
So testing people seems to be pretty easy, right? Oh, wow. I wish it was that easy to convince people to stay indoors. Isn't that right, Doc?
Wait, you're telling me you don't social distance and stay inside?
Well, of course I stay inside. Most of the time.
Most of the time?
Well, listen. I stay indoors 5 out of the 7 days of the week. But weekends are for the boys.
Jloo, you are the reason the coronavirus is still going.
Wait, Doc. Well, that's the end of What's New with Jloo. On next week's episode, Dr. Bradley joins us and teaches us about sexual education.
So, Jloo, let me ask you this. Are you sexually active?
Doc, I don't even have to answer that, do I?
Oh, yeah, you got it. 36-year-old virgin.